We have all felt sad or blue at various times in our lives. This can happen when bad things happen to us or those we love, or sometimes for no reason at all. This usually goes away, but what if it doesn't? What is the difference between a general sadness and true depression? Depression is very visible in our society today. We see the advertisements for the medication, see statistics that indicate almost 7% of all adults are affected each year, and read the stories of how it impacted the lives of many, sometimes with disastrous results. Hi, this is Arlene Smith of Sierra Behavioral Solutions in Reno, Nevada. Welcome to this edition of Behavioral Health Television. Joining me today are Kay Davies, licensed clinical social worker, and Leslie Katz, clinical director of Sierra Behavioral Solutions. In this video, we will discuss depression, what it is, its causes, how it is treated, and what you can do to get back in control of your life. Welcome, Kay and Leslie.
Thank you for having us.
It's great to be here, Arlene.
Kay, what exactly is depression, and what are the symptoms we should look out for?
Depression is an overall numbness or sadness. There are many different specific symptoms of depression, such as a lack of energy, a persistent sadness for no reason, feelings of worthlessness, guilt, sleeping too much, sleeping too little, difficulty concentrating, poor hygiene, little or no interest or motivation in participating in life or the activities that used to bring us joy. Everyone may have these symptoms to some extent from time to time, but when they persist for an extended period, it is much more likely that someone is suffering from depression. What is of particular concern is if these feelings are accompanied by thoughts of harming oneself.
A strong indication of depression is when more than two of these major symptoms occur every day for a period of at least 2 weeks and interferes with the ability to work, carry out normal daily activities, and potentially damage interpersonal relationships. These are very strong signs.
Leslie, where does depression come from? Is there a single root cause we can look for?
Depression can occur for a variety of reasons. It can be caused by a specific incident in someone's life. There might have been a death in the family, or a long-term relationship might have recently come to an end. Or perhaps there is a prolonged illness. Sometimes, however, we can get depressed and cannot identify an external root cause. In these cases, it could be the result of genetics, past life experiences, a chemical imbalance, or a number of other circumstances that are beyond our control.
Okay, what should we do if we suspect someone we are close to is suffering from depression?
Well, keep in mind that depression is really hard to self-diagnose and can lead to serious injury or even a loss of life. Therefore, it's important to pay attention to the warning signs of depression, particularly if someone has had clinical depression in the past or if they recently experienced a traumatic event in their lives. When you approach someone, be sure to be reassuring, caring, and non-judgmental. Do not challenge them and try not to tell them to just snap out of it. Get them to talk about what they are feeling and for how long they have felt this way. It's very important to determine if there is any risk of personal injury, destructive behavior, or suicide. Gently encourage them to help themselves as well as seek professional assistance.
Leslie, from your experience, what is the best way to get started with a professional assessment and/or course of treatment for depression?
A great way to get started is to seek out a psychotherapist who has experience working with different types of depression. The relationship with the therapist may be short-term or long-term, depending on the specific circumstances. Be sure the therapist that you select is a good fit both in personality and approach. It is vital there is a good rapport. A therapist will begin with an assessment of the situation and evaluation of the options for a course of care. There are a great number of options available, and it is important that the therapist understand what they are and when each is appropriate. Treatment options can range from non-traditional approaches such as acupuncture, massage, and yoga to more conventional approaches such as psychotherapy and prescription drugs, or a combination of all of these. Keep in mind that depression has a very real impact on emotions, thinking, behavior, and physical well-being. Identifying and treating depression proactively will address the situation more quickly and may potentially save a life.
Thank you, Kay and Leslie, for your insight on this condition that is becoming more and more common in today's complex and challenging world. If you or someone you love are experiencing symptoms like we described in this video, and you would like additional information, visit our website or view our other videos on YouTube. You can also call us to make an appointment to meet with one of our therapists to discuss your personal situation in more detail.
Sierra Behavioral Solutions is located in Reno, Nevada at 1865 Plumas at the corner of Plum Lane. Our phone number is 775-348-5800. If you're not in the Reno area, we are also part of River Valley and affiliates who represent high-quality behavioral health facilities across the country. We would be happy to refer you to one of our affiliate locations.
Thank you for watching this edition of Behavioral Health Television. We are dedicated to helping you find solutions to your life's problems. Feel free to explore our other videos on important behavioral health topics available on our YouTube channel.